The United States is a country of immigrants. More than 99% of Americans are immigrants or descendants of immigrants. Currently, more than 40 million people living in the United States were born in another country. This population is incredibly diverse, representing many cultures, languages, and regions of the world. There are many motivations for migration to the United States, including immigrating to the United States permanently and migrating to the United States temporarily, for example, for seasonal work. Some people arrive individually or as family groups, while others may arrive through formal programs such as the U.S. Refugee Resettlement Program. Certain communities are well established in the United States, while others are still very new to the United States. Communities represent a wide range of socioeconomic statuses and face differential barriers to health. Regardless of their differences, refugees, immigrants, and migrants, or RIM, are an integral part of the nation's social, cultural, and economic viability and fabric. While COVID-19 is a public health threat to the entire U.S. population, there is growing evidence that the outbreak disproportionately affects certain populations, including certain RIM communities. COVID-19 particularly affects those who experience economic challenges, leading to more adverse social impacts, such as loss of housing or income, worse disease, and more death than the general population. There are multiple factors that drive this disproportionate impact, including work environments that make social distancing challenging, tenuous social and economic positions that make prevention and mitigation activities, such as isolation and quarantine, difficult, and multiple barriers to healthcare access. Moreover, some state and local health departments may not yet be fully equipped and find it particularly challenging to manage COVID outbreaks among culturally and linguistically diverse populations. The National Resource Center will support state and local health departments and other entities working with these communities to reach and engage at-risk RIM, defined as communities of predominantly foreign-born individuals and their families who are likely to be disproportionately affected by COVID-19 due to social determinants and/or other factors that limit the effectiveness of COVID prevention, mitigation, and control efforts among their communities.